respiratory illness on the rise among kids in North Texas. Children's Health in Dallas reporting the highest number of RSV cases this year. Director of Infectious Disease at Children's Health, Dr. Jeffrey Kahn, joins us this morning. Thank you for being here and walking us through this. The numbers, I think, is what's so startling. When you take a look at the first week of October, Children's was seeing 125 cases at that time. Now you look at the week of October 22nd, so we went from 125, and then we see this jump up to 290. How much of a concern is that for you?
Well, certainly RSV is here. I think one of the other things that we look at is not just the number of tests, but the percentage of positive tests. And now we're at close to 25%. So the RSV season is here for sure.
Okay, so what are the signs, like what kind of symptoms as a parent should I be looking for to know if my child might have RSV?
So the children who are at highest risk for RSV are infants, particularly children less than 6 months of age. And typically RSV starts with a cold and some sniffles, sort of mild symptoms, and it gets worse over 2 or 3 days. And eventually it gets so bad that the infants have trouble breathing, they have difficulty feeding because they're coughing and they're really working very hard to breathe.
It starts with sniffles?
It could be, absolutely, yes.
That's concerning. I feel like kids this time of year all have sniffles.
Right,
yeah,
right. So it's difficult to predict early on whether your child's going to go on to have severe disease or whether this is just going to be like a mild cold. Now,
there's this drug that's being used. I know there's a shortage. Explain, as a parent, what I should be doing right now.
So the drug that's just been approved is an antibody. The antibodies are what our body produces in response to vaccines that protect us against viruses. This is a synthetic antibody that targets RSV that can be administered to infants who are less than 8 months of age, who are going to be or in their first RSV season, which is right now. So the CDC has put out this alert that obviously there's a large population that's eligible to get this drug, and so the CDC recognized that there are sort of some shortages. And at the CDC, if you go to the CDC website, they'll list all the resources if you're interested in getting this drug. Certainly for kids who are particularly prone to RSV, young children, certainly children from 8 months to 19 months or so, they should be getting this drug. It will save them, will protect them against RSV.
Protect them, and mothers who are pregnant, right? Because their unborn baby might be protected too.
Exactly. So pregnant women between 32 weeks and 36 weeks of gestation, if they get vaccinated, they actually pass those antibodies onto their fetus, and when the baby's born with a high level of antibodies to protect them against RSV.
Wow, that's amazing. I remember a couple months ago, you and I were talking, and we were worried about like this huge three, because we were saying, oh my gosh, RSV is going to be up. We were worried about the flu because this is flu season as well. I won't even mention strep right now because I know that's going around.
Yes.
And then COVID as well. We were worried that we'd see a spike in all of these all at the same time. That's not exactly what we're seeing right now.
At this point, no.
So far.
the silver lining is that the flu numbers are very low. We're talking about percentages that are in the low single digits. But they're starting to increase here. We don't know how long this RSV season is going to last. We don't know how high the flu season is going to go. COVID's still lurking in the background, so we're still not out of the woods yet. So I think everybody should keep their guard up. And the one big advantage that we have vaccines for COVID, we have vaccines for flu, and we have a vaccine for RSV for individuals who are 60 years old and older, and of course pregnant women.
It's a tough time of year.
It is indeed.
Wash your hands, wash your hands, right? All right, thank you so much.